Hi, this is Dr. Millen talking to you about carpal tunnel syndrome today. Carpal tunnel is a condition where fingers of the hand start to go tingly or painful, and the problem is at the wrist. Most of the time the involvement is actually very same. It involves compressing the nerves that reach into the fingers, and that's where the symptoms arise from. There are other problems in the hand that can occur that are very, very similar and very often confusing to people as to what it is that the problem is. The two other ones are elbow tendonitis and thoracic outlet syndrome. Elbow tendonitis occurs on the outside of the elbow typically, and it does not have to occur in the fingers. The arm can hurt at the elbow, or it can hurt on the inside of the hand, and it's never steady. It's always on and off type of symptoms. With thoracic outlet syndrome, on the other hand, the symptoms can occur anywhere in the arm. It can occur in the upper arm or the lower arm. It can occur when a person is at sleep or at rest without using their arm. All of a sudden, they just get a sensation of discomfort or tingling and so on. Another confusing thing about the elbow tendonitis is that in 70% of all the cases, the arm has no symptoms at all. All the symptoms are concentrated in the shoulder or in the neck, or actually as headaches, usually on that same side. The treatment for all of these obviously is very, very specific and very different. In the case of carpal tunnel, the most common relief is obtained through surgery. Surgery is very minor and involves reducing the pressure on the radial nerve that occurs at the wrist. In the case of the elbow tendonitis or tennis elbow, the preferred treatment of choice is usually the active release therapy, which is a manual form of therapy right into the problem of the tendonitis, or with use of cold lasers, or I should say very strong therapeutic cold lasers. In case of the thoracic outlet syndrome, it all depends. The treatment will be shaped depending on where the problem is. In thoracic outlet syndrome, the problem can occur at the neck, or it can occur at the shoulder. So that's usually the first part to determine. In all of these cases, it's of high importance as to where the impingement or the compression actually occurs in the thoracic outlet. If you have any further questions about arm pain in general, or you have any specific questions about either tendonitis or carpal tunnel, feel free to give me a call here at the office at 905-279-8004.